I get it correctly from Alan and from the rest of you, is if you put the pads on somebody and they're stuck on it, you can do infinite number of shocks on that person. If the first shock doesn't do it, you can shock up to how many?
60.
50 times.
The hard sign says it's a good battery, a fresh battery, is good for 60 rows.
That's on one patient. Once you take those electrodes off, the battery may be still good, but the pads are no good. And as I showed you on mine, the battery and the pads come together. So when you order new pads, you get a new battery.
It's around here someplace.
Yeah.
I think additionally, Alan mentioned in his class that all clothing comes off, and some of these AEDs have a shaver, a razor, so particularly hairy men should be shaved quickly so the pad has the best chance for adhesion and conductivity.
That would be a problem.
Yeah, it's gonna, it'll tell you, the AED will tell you if it doesn't have good conductivity. It'll tell you that.
Now before we start the second section, there's some things left over from the first. If you buy this hard sign, understand I'm not getting paid anything for it. It has another compartment which has a breathing mask in it and a couple of other things, and you can also attach it to your computer and have a record of it. So I've never used the blue case, but
That's partially true. Hard sign wants to know if you use the AED. And so if you use the AED, they don't come with cord anymore. Contact the person you got the AED from, or me. We'll send you the cord, download the information from the AED onto your computer, send it back, and that's how you end up getting a free AED out of the whole thing.
yeah,
They
good.
want that information, you know, for their statistical purposes.
And then generally speaking, the fire department will download the data and then take it to the hospital, so it's part of the patient record. So they have the ability to download any of the AED data.
Another thing I never told you, and not necessary for the first part of this talk, but from now on, you're going to see some graphic pictures, and if you're a little queasy in the stomach, I've provided this. And it's a gift. You can take it home with you if you think it'll help. And then I put a couple of these little package, and I'll explain to you during the next section of how best to use. They're just zero form gauze. You can buy them anywhere, but you might not think of it. But these are two to start your medical kit. I gave everybody 2 of them. And then these gloves may not work on you. They're size 7, and I used to have 8s. And as I got older, I went to 7.5. Now I have them. I had a box of 50 of these. I've been retired for 10 to 11 years. So I'm trying to get rid of them. So I thought I'd give you each. They're sterile gloves. And if you can stretch a size 7 on, then you may be able to do some of the things I'm going to tell you in part 2 and part 3 and part 4.
Sam,
Yeah.
one word of caution, these are latex.
Oh yeah,
Gloves
good
are
thing.
latex.
Yeah.
So, you know,
If you're latex allergy, you got a problem.
do not use latex because of allergies. But so you know that these are latex gloves.
If you have a latex allergy, just throw them away. Okay.
You don't want them back?
I have 50 more of them.
But you all know you have a latex allergy until you touch it.
The person you're touching may have latex allergies.
Oh, okay, yeah.
It's not even you, it's the person you're touching, and you can call them a group strategy for that. And so anaphylaxis leads to the cardiac arrest.
Well, that's a good reason. So make sure you wear the latex gloves to open your peanut packages.
Any questions for the first part before I go on? Now we're going to actually talk about ailments that occur. And the first thing is seasickness. You might not think there's a lot to say about seasickness, but there's more than you think. It's called by the French mal de mer. And concentrate on the so-called middle ear, the semicircular canals. And this is what they look like. This semicircular canal points out toward you, and it's called the lateral or horizontal one, but it's, as you see, it's not horizontal, and this is with a person erect, okay? The horizontal semicircular canal is not horizontal. And then I'll tell you what happens when it is. This is a superior, probably not much involved in seasickness, and this not much, but this is the one. Whenever you look down, particularly when you're down below and you're shut off from the input of the horizon, and that semicircular canal, which is supposed to be horizontal, now becomes horizontal. An ENT guy told me that that's when it gets maximally stimulated. When this is parallel to the surface of the water, just when you're looking at a chart below or reading a book, if I'm down there within an hour, I'm queasy. But there's something unique about my seasickness. I go up, puke once, and then I'm ready to eat a hamburger. A lot of people get seasick, they're finished. Anybody have that happen to you?
Not to me, but I was all with a crew member who did.
Yeah. So, guess who had to deal with the astronauts? There's a guy named Dr. Graybill. Anybody know him? One of the doctors at Annapolis, I gave this talk at Annapolis Yacht Club, and one of the guys was a friend of Dr. Graybill. He was charged with responsibility of figuring out the whole motion sickness for astronauts. So he built this centrifuge for a human to ride in the capsules. He weighted on one side and had a capsule on the other. In addition to going around, he could make the capsule rotate and the astronaut rotate inside this capsule at the same time. So he made them all sick intentionally. They signed up for that, so they had to endure it. And his responsibility was to figure out what to do about it. Because you can't have sick astronauts. So this is what he learned. That there were 3 phases to seasickness. And the first 2 he called the mental phase. And that's when the person becomes apathetic, tired, a little sleepy. So if you have someone on your boat who's not paying attention, doesn't look very much interested, less interested than he was 2 hours ago, he's on the way, my friend, to being sick. Then phase 2 is the physical phase, and that's when you vomit. And if you vomit a lot, you're already tired and weak, and now you're prostrated and you're useless as a crew member. And then Dr. Graybill talked about adaptation and recovery. Anybody have any experience with adaptation and recovery after 3 days? Anyhow, that's what Dr. Graybill said. So I'm sure that's not true of everybody. It certainly wasn't true of Greg Steiner. The problem is dehydration and prostration. So he was discharged with what to do to prevent that. And he said, because there are 2 phases, there's the sleepy phase and there's the sick phase, you need 2 medications, 1 for each one. And he tried a lot, but he came up with Phenergan. And guess what? That's a prescription drug. So when you sit down with your doctor about Percocet and Ativan, throw in Phenergan if you can. So the Phenergan was to prevent the nausea, and it's either given orally or rectal. But then he needed ephedrine, which is an upper, that counteracts not only the sleepiness of seasickness, but Phenergan makes you sleepy. So every astronaut, before they launched off, got Phenergan and got ephedrine sulfate. I don't think you can buy ephedrine anymore. I'm not sure it's even made, but they have methamphetamine, you know, other uppers that you can take. Now, what can you buy over the counter that might just be an alternative to this? Well, Dramamine. Anybody take Dramamine? Can't take it, makes you sick or too sleepy? No problem with it. So that could help phase 1. That's the nausea part. And then you can buy caffeine. It used to be called no dose, but you can buy caffeine 200 milligram tablets. And that's about equal to 2 cups of caffeinated coffee.
Or drink a Red Bull.
Red Bull, yeah. How about, does Mountain Dew have?
Mountain Dew is full of caffeine
Yeah.
also.
So there you go. You got some choices, but I think Dramamine is the best seller, but there are other options. If you don't like the drowsiness that Dramamine gives and you don't want to take caffeine, then they make Dramamine less drowsy, and that's called meclizine. It's a different chemical. But that comes under the trade name Bonine, so you can get meclizine instead of dibenhydrinate, which is Dramamine. So you have those options, and you really don't have to worry about Phenergan. But I carry Phenergan because it's really heavy duty. It always works. Do you have any experience with people that took Dramamine and it didn't work? I can't remember. Now, how about the scopolamine patches? You ever hear about scopolamine?
They used to be really big, yeah.
I'm sorry?
They used to be really big and popular. You'd see people with
Yeah.
patches on all the time.
A little patch behind your ear. I tried it, and my wife tried it. We both had visual problems. It makes your pupils constrict down. So I had trouble seeing with it, and I just couldn't take it. But it worked, and it worked for her. We just didn't like the visual effects. Has anybody heard of Stugeron?
Love it.
Do you have it? Do you like it?
Yes.
Anybody here? Nobody here?
I talk about it.
Well, it's not made or sold in the United States or Canada, but it's made in Vietnam, it's made in the UK, so if you're going to get it, you're going to get it online. It's said to prevent and cure seasickness without any side effects. That's what's said about it. But here's the problem. It's the trade name is Stugeron. The generic is Cenarizine, I'm sorry. There are 40 different preparations that it's in. It's made by Janssen Pharmaceutical. It's considered an antihistamine, that's why it counteracts nausea, but it's also a calcium channel blocker, and it comes in several doses, as you can see there. It's not FDA approved due to many reports of adverse reactions, including coma and death. It's banned for use by all pilots in the United States because of reports of impaired judgment. Available from other countries like the UK via the internet for about $10 for 30 15 milligram tablets. So if you want some, I've never tried it, so I just advise caution. But here's 2 anecdotal stories.
Well, I could, first of all, I've never got seasick yet. You know, or I haven't gotten seasick yet, so I don't personally have any experience. My experience with Sturgeon is from my friends that go to the Bahamas all the time. They pick it up in the Bahamas and they swear by it.
Yeah.
That's, I mean, I've never heard of anybody having an adverse reaction to it. You know, again, that's what I've heard,
Yeah.
or haven't heard, and my friends that use it love it. That's.
Julianne, you used it? You like it?
I just take it just as a precautionary,
Yeah.
just to prevent anything. I've never had any issues.
Now, these are all the other seasickness remedies. There's ginger tablets. There are herbal remedies. Ginger ale, ginger snaps, acupressure. There are bands that affect acupuncture site P6 on the wrist. There are wristbands that have electrical stimulation, and there's aromatherapy. Dab a little under your nose or behind your ear, and your nausea is supposed to go away. And the message here is whatever works for one patient, stick with it. If it works, stick with it. But if it doesn't, try something else. Whatever works for one person rarely works for everybody when it comes to seasickness.
Ginger snaps, the official boat cookie.
I'm sorry?
I said ginger snaps, the official boat cookie.
Yeah, right. No reliable treatment that works for everyone. The thing that comes closest to it is Phenergan, which was advised by Dr. Graybill. How about assigning the victim to lookout duty or to helmsman duty so that they can see the horizon all the time? Now, how about scrapes and cuts, lacerations? Just to tell you that no wound has to be sutured. Wounds will heal without being sutured. They'll look better, won't be so ugly, and maybe less chance of infection if they're sutured, but they don't have to be. So waiting 2 days isn't the end of the world, even for large lacerations. I keep this non-antibiotic, you used to keep this non-antibiotic soap, liquid soap in my boat. And I had a Beneteau 43, so I had 2 heads. And I had one of those in both heads. Now, how about irrigating solutions? Maybe a wound's dirty and you want to irrigate it. You don't have sterile water on your boat, but you have bottled water. This is povidone. It's 10% iodine. And betadine is the same thing, it's just the trade name is betadine. And you can convert your bottled water into sterile bottled water if you add 2 teaspoons to a pint. Now this is a bottle of water, comes 16 ounces, and it comes in 8 ounces, small. But if you have a 16-ounce bottle of water, put 2 teaspoons, you may not see that, but it says 2 teaspoons per pint of water. And just label that disinfection solution. That's for your boat. I don't think I brought any with me, but I have it in another first aid kit. Shake it up, and it's a good irrigating solution. If you don't have that, just use bottled water. It has no pathogens in it. It's not listed as sterile. No bottle of water is listed as sterile. It has minerals in it and other chemicals, but they promise that it has no pathogens, no E. coli, no staph, no strep, no pathological organisms in it. But you can render it sterile in this fashion. So for irrigating solutions, just to summarize, either use bottled water that you're likely to have on your boat, or make this disinfection solution. Now let's talk about stopping bleeding, and I'm going to show you something that you may have heard of. I'm sure that the EMT guy has heard of it. This is something that should be cheap because it's made of shells, leftover shells from shrimp, from crabs, from lobsters. They're made of chitin. If you take chitin and convert it into a polymer called chitosan, it's a great thing to stop bleeding, and I have a little video to show you. I don't know how that switched, but that's not what I want.
Producing Celox, the revolutionary new hemostat. The following demonstration shows Celox being tested on a deep arterial bleed. The femoral artery is severed and then left to bleed. The industry standard test for hemostatic agents is to let the wound bleed for a full 3 minutes. This allows blood pressure to drop. However, to make it more challenging, Celox is used after only 90 seconds. The pooled blood is mopped away, and the contents of the Celox packet are poured directly into the wound. Celox is safe to use on the entire body, including head, neck, and chest wounds. Compression is then applied for 5 minutes, in accordance with standard protocols for arrest of hemorrhage. Celox is simple and safe to use, and no specialist training is required. Celox is not exothermic and will not burn the casualty or first responder. As Celox works independently of normal clotting factors, it's able to work in very cold or hypothermic conditions and also clot heparinized blood. After compression, the wound is examined and any excess powder wiped away. The tensile strength of the wound is rigorously tested to simulate transportation of the casualty over very rough terrain. Even after this tough test, Celox prevents rebleeding. The removal of the clot is simple, and the blood cells that have locked together are easy to clean up. This allows for a more permanent surgical repair to be carried out when appropriate. Remember these exceptional features. Celox works independently of normal clotting factors. It's therefore effective in hypothermic conditions and able to clot heparinized blood. Celox provides rapid and strong clot formation and is effective for severe arterial bleeds. Unlike some rival hemostats, Celox is not exothermic, making it safe for both casualty and first responder. Celox has a 3-year shelf life and needs no specialist storage conditions. Celox has not only outperformed its rivals in clinical
Well, we'll stop that for a second. Now, you might not appreciate that's a pig's femoral artery bleeding, and the pig would die if you didn't do something. Can't put a tourniquet on an arterial hemorrhage of the groin or the armpit or the neck. So tourniquets are of no value there. This is the best thing I've seen, and I learned about it at Walter Reed because it saved a lot of lives in Iraq and Afghanistan. And they cut down the use of tourniquets a lot because tourniquets have their problem, and I'll tell you about that in a minute when I get to it. But Celox powder. But what about using powder on the boat when the wind's blowing? You dump that into a wound, the wind will blow it away. So they make this in gauze form. And that's the one that I recommend to you, gauze form. And I want to show you a little video of that.
If a person is allergic to shellfish, is that a problem?
I haven't heard anything. In fact, they comment about it, that it's not the chemical in shellfish that makes people allergic, so you can use it. People allergic to shellfish have had this product, you know, Army guys injured on the battlefield, hasn't been a problem. So let me show you the gauze form. It's called Chitin gauze, named after chitin, which is the substance in shells.
This video will provide you with the necessary understanding for how to successfully apply Chitin gauze from Hemcon Medical Technologies and provide an overview of the product. Chitin gauze is a new hemostatic, highly flexible chitosan impregnated gauze for the control of severely bleeding wounds. Designed specifically for military use, the dressing is 4 inches wide by 4 yards long. Unlike rolled gauzes, Chitin gauze is Z-folded for easier handling and rapid application. Based on the test protocol designed by the Institute of Surgical Research, Hemcon conducted this in vivo femoral 6mm puncture model to demonstrate hemostatic efficacy and application technique in an uncontrolled hemorrhage situation.
Another pig femoral artery.
Chitin gauze is applied directly onto and in contact with the source of bleeding. Continue packing the wound site with the dressing, making sure you come into direct contact with all bleeding surfaces. In this video, 2 sections were used to account for the full 4-yard dressing. While packing, if all of the dressing does not fit into the wound cavity, use the excess to back the wound. Once the dressing is in place, apply firm, direct, even pressure to the wound site and continue holding pressure until hemostasis is achieved. Leg extensions were performed 3 hours post-op to validate continued hemostasis and no occurrences of rebleeding. Chitin gauze is a highly flexible dressing which readily conforms to varying wound surfaces to rapidly stop bleeding and seal the wound site. The naturally unique characteristics of chitosan and Hemcon's proprietary manufacturing process together create chitogauze, which slows the blood movement through the dressing, offering a local hemostatic solution. The chitosan in chitogauze binds red blood cells and platelets on the dressing surface, which provides for localized clotting independently from the normal clotting cascade. As an added benefit, chitogauze offers antibacterial properties that are effective against a wide range of microorganisms, including MRSA, VRE, and Acinetobacter baumannii. Built on a solid foundation of proven success in providing
I think we've seen enough of that anyhow. I would store the gauze. I think that's better for a boat. Go ahead, any comment?
Yeah, if you had a bleed and you used one of those two to stop it, you would leave it in place until you delivered the person to medical care,
Yeah,
correct?
I would. Yeah.
In other words, you might cover it or in some way, but other than that, leave it alone.
Did you hear what he said? Leave it on until you called for rescue and they came and picked the guy up, or you got back to
Normal rule
him.
for bleeding that if you start packing in things and you get bleed, you pack on top. You don't remove what's already soaked. You
Right,
just
it's
keep
back on top. Now, in my experience, and I packed a lot of wounds, 7 minutes by the clock will stop all of bleeding except for a wide open femoral artery or carotid artery. For that, you need something like this.
Now that does
But 7 minutes by the clock with anything, your hand will stop almost all bleeding, not all, but almost all, and this will handle the rest. Go ahead.
So that's not stopping the flow of blood through that artery, though.
Well, you hope not, but
'cause you don't
they
want
never
the clot.
told whether the pig's leg fell off later on.
Yeah, but the choice is die or have, maybe
Yeah.
lose a leg.
Yeah.
No, I know, because then when you start talking tourniquets, that's the other situation, because you are then stopping the blood flow.
Well, in any case that you would use a tourniquet, if you have this stuff, you could probably use it and strap it down.
Yeah.
Yeah.
I got in trouble once saying, well, you no longer need a tourniquet or it's less common. Wow, I get a lot of trouble for that, making that statement, but it's
Take it
true.
off, what do you do?
I'm sorry?
You take it off, what would you do? Or you don't take it
I don't
off?
take it off.
Don't take it off.
Take it off until the person's in the medical center.
Where they can,
And the important thing is this doesn't depend upon your body's coagulation mechanism. It's separate from that. So it works when the person is on anticoagulants like Coumadin or Plavix.
Eliquis.
Also, hypothermia prevents blood from clotting, and this will clot people that are hypothermic also. So it's a good product to have.
Now, can that be bought in a drugstore, or do you have to get it?
No, I've never seen it, and I've asked drugstores, why don't you keep it? They said, oh, well, no, we don't. Yeah.
We highly recommend it also. Celox does come now in a Z-fold pack, not just granular. So you can actually get the brand name Celox.
Celox in gauze
In
form.
gauze pack.
Yeah.
One of the reasons that they don't carry it in drugstores, you can get it on Amazon, by the way.
Yeah, you get it on the internet,
Is
yeah.
that it's got it's not a relatively short shelf life, but it does have a shelf life that they advertise. And it's not cheap. But
Yeah, it should be cheap because you use a product that's,
No, I'm just saying it's not.
Yeah, but it isn't.
It's not gauze pad cheap, when you think about just gauze pads. It's, and Celox is by far, I totally agree with them, the preferred product.
do you carry this in your kit?
I do not have a personal kit that has that. I was interested in where you get it, so thanks for the Amazon.
Yeah, Amazon, and there's a couple other places. I might even be able to get it for you cheaper. There's a couple of first aid kit manufacturers that stop the bleed, not first aid kit, stop the bleed kit, which has become very popular now. They even have stop the bleed boxes next to their first aid kits. And some of them are putting in Celox. Most of them put in Quick Clot which I know you're going to address, but C-Locks is by far the preferred product, and I can get it through those same manufacturers that make stop the bleed kits.
Yeah, that's going to count.
Yeah.
You can do it that way as well.
Yeah. I'm going to go get the sandwiches, so I'm going to bail out for a little bit.
Okay. So you've got Seal-Ox, this kind of sand, it comes in gauze, and Hemcon is the other brand name. One of the other complaints about the powder is that it can embolize. That is, it can travel downstream. I think it's theoretical. I'm not sure anybody claimed any injury from dust particles that get into the circulation, but that's obviated by the gauze form also. So there's Seal-Ox and there's Hemcon are the trade names. Both come in powder or gauze. For your purposes on a boat, I think the gauze form is the better. I say hold pressure for 7 minutes. 5 minutes isn't long enough. And don't check it to see if it's stopped. Keep it there, get the time, and don't move. Keep the pressure on for 7 minutes. One of the things that the gauze form is for third-degree burns. We'll talk about that later. So just remember there's a dual purpose for having Hemcon. Now I warn you about this. He did mention it, Quick Clot. There is a product that you can get in the pharmacy called Quick Clot. It's not chitosan. I don't recommend it. What it is a clay-like substance with glycerin and silica in it. It's not effective as Seal-Ox and Hemcon because it does depend on your body's clotting mechanism. So it's not effective if a person's on anticoagulants or hypothermic. So it's not recommended. Don't buy Quick Clot. One of my friends who had this lecture run out, and he said, I'm all set, I got it, Quick Clot. I never told him. You didn't listen. You got the wrong thing. And he did buy it at a drugstore, so you can get Quick Clot, but it's not what we're talking about. It's not chitosan. Now, what are we talking about? Blood loss, which leads to volume loss, which leads to shock. So the next subject is shock. That means the blood pressure is low, and since the blood delivers oxygen to the heart to itself, blood to the kidneys to the brain, then those structures don't function well and are liable to failure if shock continues long enough. There's also mental changes due to lack of oxygen to the brain, passing out on a tip that's sitting or standing. Carotid pulse is weak, and that's normally where you test the pulse because the wrist pulse disappears very quickly in emergencies. You don't feel it, but if you can feel the carotid pulse, you're almost sure that somebody has a blood pressure above 90, systolic. Same with the femoral. If you can feel a femoral pulse, it's probably above 90. Now, when does shock occur? Well, you have about 13 pints of blood in your circulation. You use 40% of that. That's like 4 or 5 pints. You may be doomed. You usually see it externally, but you can lose 4 or 5 pints of blood internally and never see it. A fractured femur can bleed that much into the tissue and you have a big swollen thigh, or what's worse is fractured pelvis. That can bleed internally into shock and be fatal. Can be. Other causes of what we call shock, that means drop in blood pressure sufficient to cause organ failure. Well, fluid loss from burns can cause shock, particularly third-degree burns. Anything that dilates the vascular bed where the quantity of volume that the blood circulation can hold is larger than what you really have. And that varies. It can vary, that blood vessels can constrict and dilate. And one cause is septic shock because the organisms, many of them, produce a toxin which causes blood vessels to dilate. And now your blood volume that used to be good is now inadequate for the size of the vascular compartment due to infection, septicemia. Or you can be allergic. Toxic shock from man-of-war sting, for example, or any kind of allergy can produce anaphylactic shock, and we'll talk about that in a minute. Again, blood pressure disappearing sufficient to not to deliver oxygen to the tissues. What about treatment? Well, you got to stop the bleeding somehow, but you can't stop the bleeding from a broken femur or from a fractured pelvis. We talked about pressure in the hemostatic product for stopping bleeding and a tourniquet. What's the treatment for shock that you can do with body position? Well, you can't have them sitting. They have to be down and hopefully legs raised, because remember, you're transfusing a pint of blood with each leg when you raise it. So down flat with the legs up. Now, it may be severe enough when you're on Route 65, 400 miles from the closest. Unless you have some way to give an IV or expand the fluid volume, I'm afraid the person's going to die, and there's not much you can do about that. Tough thing to accept, but that happens. Now, how about anaphylactic shock due to bee stings and shellfish and other allergies? Usually the people that have these allergies know about it, and they carry the medication with them. So that's the comment I wanted to make, that people who are used to it usually have their own medication. How does it start? Well, itching, hives, breathing problems. It'll make asthma worse. So you can try Benadryl. That's an easy thing to do. You notice swollen lips and tongue, wheezing. A person with asthma can have their asthma accentuated, even to the point of choking and loss of blood pressure. At that point, they're doomed unless you have EpiPen. Everybody familiar with EpiPen? Now, there are cases in which you give the person EpiPen, and in 20 minutes they feel fine, they're better, and say thank you very much, and in 20 minutes they're back into it again. So you got to give them a second EpiPen. So how do they sell it? They sell it as a 2-pack. And because they know that you don't know how to give it, they have 3 things in here: 2 EpiPens and 1 practice module. So I'll show you the practice module. It doesn't have EpiPen, and it says trainer on it. And the other 2 with the active ingredient is in here. And it tells you on the package how to use it. Now, usually the site of injection is your thigh, about 1/3 of the way up from the knee, or up to the middle of the thigh. And this tells you, twist, take this top part off. Now you're ready to go. The needle's buried in here. And unlike the old ones where you had to have your thumb on top, this is just a firm grip. And you want to hit it and hear the snap and hold it for 10 seconds. So you think of that in advance. You don't want to miss or go off to one side. You want to maybe take a few practice swings like a golfer addresses the ball 2 or 3 times. And then you give it a hit like that and count up to 10. Keep it firm. And then take it out. And it's amazing how instant that reaction is for somebody who's allergic. They begin to breathe and they feel well, and they're very happy. Most of them carry it with them. They know about it because they've already had bee stings. My son is one of them. So every time I buy a 2-pack, I buy it for him. Big problem with EpiPen, it's one of the most rapidly deteriorating drugs you have. Mike asked during break time, and I'm going to talk about how long do drugs really last on the shelf. This is the worst. This lasts anywhere from 6 months to a year, so you have to buy it every couple of years, or every year.
Every year.
Now, you put this back together again and can use to practice again if you want by, it has a flat end, it has a round end, so you match that up and twist it on, and then you have to put this back on. And now you can use it again or practice again. Any questions about it, EpiPen?
Is this the device that some guy, some hotshot bought up the rights to it or to the drug and jacked up the...
And the price went up to $400. It is. It's the same thing.
Is it
Yeah.
still at $400?
No, I got this last one a week or so ago. I was due for a renewal, and it was $200, and Medicare picked up about half of it, so I paid $120 for it. But it is more expensive than it should be. It used to be $59 for both of them. I'm talking about 20 years ago. Any comments about EpiPen or tourniquet? This is called a combat application tourniquet, or a CAT tourniquet. And I don't know how much time that was, but it was less than a minute, wasn't it? 30 seconds?
Probably closer to 15 to 20.
Yeah, not long.
And now my fingers are starting to get numb. Now I applied that in 30 seconds or so with one hand. So that's how interesting. You put the time on here, and we'll talk about why you do that. Now, will this be needed if you have heme con or Celox? Probably not, because where do you use it? You use it when the bleeding's from the popliteal artery or somewhere in the ankle, or you have an amputation and you're applying it to the thigh area, or you have hemorrhage from the, and Celox or HemeCon will stop that bleeding in 7 minutes anyhow if you can push it. But this is something to do while you're rooting through your pack trying to find the HemeCon.
Oh, okay.
Because you can't leave this on very long or you'll lose the hand or a foot. So let's talk about the downside of tourniquets right now. You've got to get the full picture. You need a tourniquet algorithm, because if you don't release the tourniquet in 3 or 4 hours, the hand or the foot is lost. It has to be amputated, becomes gangrenous. So they talk about an algorithm. Release it each 45 minutes or an hour. If bleeding is stopped or decreased enough to be controlled by local pressure, allowing blood to circulate and collateral circulation to be resumed, then you can tighten it up again, but somebody has to monitor that and release it. Well, why not apply it once, and when you take it off an hour, not put HemeCon? Because already when you put a tourniquet on, it really slows the bleeding, even from an amputation or a big laceration of your forearm. Any questions about that at all? So I think this is one of the best of the tourniquets. I think I bought it for 30 bucks. And again, the corpsmen and the people that I've taken care of from Iraq and Afghanistan swear by it. They think it's a great thing to have. It's about $28 or $30 or so, and I carry one. But I think I have now 2 ways to stop bleeding peripherally, below the knee and below the elbow. Any questions about tourniquet? I was using poor judgment I use it with a doctor in the audience, a physician, and he wrote me a very critical remark. You should never have said a tourniquet is not needed with. I should have said tourniquet's less useful, blah, blah, blah. I could have worded it anyway, but why I said a tourniquet's not needed.
I think what you said was really interesting, the fact that you said the tourniquet stops the bleeding immediately and gives you time to find your...
Yeah, root around in your supplies to find your hemostatic product. So that's called a CAT tourniquet. You order it on the internet, CAT tourniquet. And CAT stands for Combat Application Tourniquet. And it's carried by all corpsmen and was very useful in Vietnam and Afghanistan. Now, I'm not going to show you this very long because it's an amputation of a thumb. And I know you don't want to see that, but this is a thumb sitting on a pad. And this is what was amputated. So I'm not going to show you that very long because you saw what I wanted you to see. But if you look at it, I'm afraid you're going to use your barf bag. So how to treat that? And that's why I gave you these little packages. This is the ideal thing to put on an amputation stump. You're first going to squeeze the thumb or the finger to stop the bleeding. It's amazing how little bleeding there is from an amputated finger or from an amputation thumb. You think it would be fatal, but it's never fatal. You don't lose that much. But if you circle or push the thumb against the hand and then had them do it while you root through your pack to find this, okay.
They'll make a mini cat for that?
So flush the wound. What to do with the stump? You flush the wound with that disinfectant solution, or bottled water will work if you don't have a disinfectant solution. And by the way, some people think that pure betadine or Providone is toxic to the tissue. I've used it for years mopping the back or the head as a skin disinfectant. But some people think putting it on an open wound raw, not diluted, it can be toxic to healing. And that's the problem with pure full-strength betadine. But if you have the dilute solution, it's just like a sterile flooding solution, so you can wash. So I say flush with bottled water or the disinfectant solution, put that zero form, and then 4 4x4s. And here's the picture of the zero form on the stump. Notice it's not bleeding very much. And then wrap it 4x4 and a wrap around it, and leave it that way until the person's rescued, or if they want to continue the voyage, it's their call. They're useless as a deckhand, but at least they have one hand, and it doesn't really hurt very much if they can have their pain controlled. They can use one hand, feed themselves, usually dress themselves, maybe need a little help, but sometimes I've seen people have amputated fingers. Now, how do you amputate a finger on a boat? Not on a 30-foot boat, but if you have a big boat with 2 big diesel engines, then it's usually an engine room problem, or you have a big boat with a chain anchor and you can lose a thumb. Otherwise, it's such a rare injury, I'm embarrassed to even show it to you because you all have boats in the 30 to 40-foot range. And
don't you have much trouble with people getting their finger crushed? Like if they get their hand between the boat and another immovable object?
Yeah. Having your finger crushed is worse because you can't save the finger. Now, when I started this slide, I said there's a psychological part to this. You call for rescue if the person no longer wants to continue the voyage. But what do you do about the digit? Well, you wrap it in a sterile gauze moistened with bottled water or that disinfection solution. And it should be a waterproof bag. Now, this snack size bag like that, I have a mock-up of a thumb inside with just bottled water on it, just so it's waterproof. And then you put that in a bag of ice. Now the ice is going to melt, so it'll be ice water in the refrigerator. Don't put it in the freezer. Keep the bag, keep in the refrigerator, but not the freezer. Can you see that? Read that. Now it goes with the patient to the medical center. Sticks with the patient. Now here's the psychological part. Should you have it in front of the patient? Should you give it to them? No. No.
Hold this.
You need this later.
Put this in your pocket. No. That's where you're using a little psychology. Unfortunately, and this is what you tell the person, what you're learning now, I don't want you to tell the person. You have to know it. It's called the surgical replantation of the digit. And it works best if it's less than 12 hours. You have no way of getting the person. And it's unlikely the place you would take them does replantation surgery. Because all replantation operating rooms have a little place off to the side in the room next to the operating room that takes care of these stumps. They have to find an artery of the stump, not the stump, but the amputated digit. They have to find an artery, put a catheter in it, and irrigate it, and they have to prove that fluid goes into the thumb and comes out the vein. So if that's clogged and can't be irrigated, they can't do the replantation. Now, when this first started, the first one of these replantation was done in Japan in 1965. So you think the Japanese are experts at it, and they probably are. Anyhow, they did all the experimentation. They did it day 1, day 2, day 3, day week. They even did implantation after 24 hours, and occasionally one of them worked. So you save it, and if you can get to a medical center within a day, there's a possibility that it will work. Otherwise, the thumb amputated part deteriorates or it clogs so that they can't irrigate. Because unless your bone blood can perfuse the stump, it will not grow, stick. But if you get it done in 12 hours, there's a 57 to 87% chance, and that percentage has gone up since I wrote this. Some series are 90% effective, not 100%, but 90% effective in replacing fingers and thumbs if it's done within 12 hours. Any questions? Any of you have an amputated? No? Now let's talk about hot and cold injuries, and I know it's getting close to lunchtime. How about 12:30? Is that good enough for lunch?
Yeah.
Let's talk about hot and cold injuries. This you can relate to. And there are two conditions. This says heat exhaustion. This says heat stroke. These both occur 1 day to 3 days, usually in a hot environment. And there's a world of difference between heat exhaustion and heat stroke. This is 30% fatal. Nobody dies of heat exhaustion. Let's go over it a little bit. First, heat exhaustion. That first thing says, if you take their temperature, it's usually normal or no more than 100. I guess you can follow, because I'm sure you can read this, but it's on your handout. It's usually exertion, sports, or hard labor in a hot environment. And the key is profuse sweating. That's the big key. It's so bad, in fact, that the loss of salt and fluid can have a physiological effect. Now you're in a state of fatigue and prostration. My son had this, he was rowing. They actually won the race, and he collapsed from heat exhaustion. And I had nothing to help him with. I ran up and got the truck selling pretzels. And I got a pretzel, and fortunately we got some water from a pump, and I put a little salt, and he revived. Now I don't know whether that caused him to revive or not, but I take the blame for it. I take the credit for it.
Why not?
But you're mentally clear. I had that in a different shade of color, but you can't see that. Mentally clear in heat exhaustion. Nobody's confused. If they're confused or bewildered, it isn't heat exhaustion, it's something else. Most of them complain of some kind of muscle cramps. That's true of football players. They're on the field for a long time. What's the treatment? Rest and rehydration. It always works. Recovery is rapid, within minutes or hours. And then there's a discussion of acclimatization. What is that? Well, a lot of people who move to the south, take a job in the tropics, suffer heat exhaustion the first 2 or 3 days, but they say that after a week or 2, 3 weeks, they notice they don't sweat as much. So there's something happens in the brain with your heat control mechanism that shuts down your sweat glands. Finally, your brain figures out, really, you don't have to perspire that much. And they claim that they don't get exhausted or have heat problems anymore. So they call that acclimatization. It's partly a brain problem, partly a physiological problem. The heart participates in it because the heart slows up a lot and those people can handle it. Now let's talk about heat stroke. What this says up here is the temperature's up to 104. That never happens with heat exhaustion. So 104, it isn't heat exhaustion. And it may be you can't save that person. It's already too late, many times, 30% of the time anyhow. These are people my age. And unfortunately, one of the problems we have, as you age, a lot of things happen to your brain, but one of them is your temperature regulating mechanism doesn't work as well. And it doesn't tell you you need a drink of water. So us old duffers rarely drink, and we become chronically dehydrated all the time. No or little sweating. Either that's due to the mechanism in the brain that doesn't turn the sweat glands on, which happens to old people, or what's most likely the cause is, as I'm saying, failure of the temperature regulating mechanism of the brain. And this says, I can't read it myself.
Meds, especially recreational drugs.
Yeah, medications can affect the brain, the rate at which you perspire. So there's always mental confusion. At some point, there's always mental confusion. And this is a situation where you find they call mother and she doesn't answer the phone. She's been in the apartment by herself in South Philadelphia for a few days, and they go and they find her dead. And this is the usual cause, particularly in the summertime when it's hot. No air conditioning. Emergency, you have to go to the emergency room and they apply wet soaks or cold water. Now what can you do 400 miles offshore? Well, you got to get the person cooled down. So you have to apply cold compresses to the skin and you have to hydrate them, and they can't take enough by mouth to cure them. But you have to try to get them to drink, cool them down, and have them drink. This says emergency, wet cloths and ice to the body, oral fluids is rarely adequate. They can't really take enough because they need 3 or 4 liters quickly. 30% mortality rate, even under the best of care. Any question about heat exhaustion or heat stroke? Have you ever seen it? Ever had neighbors die of it? No? What not to do? Well, it's recommended that you don't use alcohol as part of the sponge bath because it can be absorbed. Aspirin is not good because it can interfere with the clotting mechanism. And Tylenol can be hard on the liver, worse in a dehydrated person. So don't use these 3 things. At least they're not recommended. Now let's talk about burns. The first thing here says sunburn. 1st and 2nd degree burns with sunburns. You're talking about UVA and UVB. UVC is all absorbed, 100% absorbed by the ozone layer, and it never reaches the earth. UVA causes all these wrinkles on my face and a little bit of sunburn. It's UVB that really causes the worst sunburn. But it never goes beyond 1st or 2nd degree burn. This second thing says scalding wounds. Now you're up to 212 degrees. It can cause first, second, and third degree burns if you're in scalding water long enough. That usually happens in industry. How about cooking oils? They're up to 375 degrees and they're almost always third degree burns. If the cooking oil falls from your stove and it hits the kid underneath, he's going to have third degree burns before you can do anything much about it because of the coefficient of heat of oil and the length of time it takes you to get it off or to cool. Now how about burning clothes? I've never seen anybody with burning clothes who didn't have third degree burns. They roll around on the ground, they do lots of things. Maybe if somebody's right there with a bucket of water and as soon as their clothes catch you, put it out, but that rarely happens. It takes time to get the water and put it out. So you're talking about third degree burns if somebody's clothes are on fire. And then there's a special case, it's flash burns to the face, in which they inhale the heat as part of the burn. So they have second degree burns, and then there's a light threatening airway, and I'm going to tell you about that in a minute. Now this is just a diagram that are in most EMT manuals that shows first degree, second degree, and down here is where the nerves and the blood vessels are. And here's the hair follicle and the sweat glands. They're intact with the first degree. They're also intact on the second degree, and they're all gone on the third degree. This is another diagram that shows third degree in the center, second degree zone, and then first degree on the outside. So all third degree burns have some surrounding area of first and second degree burns. Now a quiz is coming up, so now I'll get ready. So burns, first degree is red, painful to the touch, but no blisters. Second degree, same thing, red, painful to the touch, but now you have blisters. So the difference between first and second degree burn has blisters. Third degree burn, no pain because the area burnt all the nerves, and there's a little pain around a third degree burn, but to the touch, the person feels nothing and it's usually black, usually. And because of the second and first degree burns around the wound, after half an hour or so, it gets tender around it. But this is somebody with a sunburn. So what's the degree of burn there? This is your quiz.
First.
Yeah, first degree. Okay. How about this? This is a person who had a scald on the thumb.
Second.
And there's a great big blister. So that's a second degree burn. Now how about that? What this is red. This was a big blister that broke, and so there's some loose skin here, but this is red and tender to the touch.
Second.
What is it? Second degree burn. What's that? No, that's black.
Third degree.
Third degree.
Definitely.
Now, this is a tough one. This is a person who had a scalding wound of the face. That all looks to me like first degree, but there's a little, what you don't see is a little blister on the ear. So that's first and second degree burn because that is a blister. Got scalded on the face and it ran down his neck, so there's a certain amount. Now how about this? This is a knee, and the black, this is the kneecap, and the knee is charred black. It's insensitive, that's a third degree. Full thickness burn. I'm sorry you can't see this better. Now this was a third degree burn, and the guy said, I don't want anything done. This is 3 weeks later. On the ankle, full thickness loss. It was painless. He said, I don't want anything done. So he's ready to have a skin graft, but he just chose not to have it. He just dresses it every day. Third degree, 3 to 4 weeks, he's ready for a skin graft, but he chose not to have anything. Now, what do you do with burns? When do you call for help? And that has to do with the rule of nines. The rule of nines is that you look at the person's burn and you try to judge what percentage of the body is burned. So we're working up to when you call for help. That's what we're aiming at. If you remember the rule of nines, 9% for the head, 18% for the chest, and 8% for the back, 9% for each thigh, 9% for the leg and foot, and 1% for the genitalia. For a baby, slightly proportions are different. So what do you do for first and second degree burns? Well, I carry this sunburn remedy, Solar Cane. It works very well. It has aloe in it. There's another one called Burn Gel, and it claims to have vitamin E in it, so you can get various things. So here's Solar Cane. You get it as a sunburn remedy. You get it at a drugstore. That's what I carry. And this is Burn Gel. It's also same thing. It has a cane in it, an anesthetic in it that'll remove the pain. No need to put it on a third-degree burn, except you put it around the third-degree burn where the first and second-degree burns are, but not on, it's no value on the burn. But I'm going to tell you what's of value on the burn in a minute. And I carried on my boat the same solution. They recommend no antibiotics, so I take soap that doesn't have antibiotic in it. Third-degree burns. Wash with soap and water. Apply Celox or Hemcon. So that's the secondary use. Put that on the third-degree burn. You don't have to worry about any other chemicals, and just wrap it up that way. Good to saturate this with either disinfectant solution or bottled water. Put it on the burn. This has an antibiotic in it. And keep it that way until they're rescued, until you get them to a medical center. Pain control with meds. We're talking about third-degree burns. Pain control with meds. Solar Cane around the edges for the first and second degree part around the wound. Burns are over 10% push fluid. Now, I mentioned 10% for a reason. Now, what you can't see here, and I'll try to point it out to you, this is somebody's right hand with black gloves on. And this is their left hand, and they're holding this piece of saturated Hemcon, Celox, chitosan, all the same thing, that's been saturated with bottled water. And they're ready to put that on a third-degree burn. Dressing Celox or Hemcon gauze, it's not only cooling, but it's antibacterial. When to worry? Well, if you have a 20% second-degree burn, that can be dangerous because of swelling and loss of fluids, dehydration. Or if you have 10% third-degree burn, that's when you call for rescue. Both of those conditions lead to dehydration and possibly shock, and you must push fluids. And if you remember a number of years ago, particularly you guys who've been in the Army, the Brooke Army Hospital in Texas had a burn center, and they worked out all of this that I'm going to tell you in terms of fluid therapy and what percentage of body wound is dangerous. So this is all from the Brooke Army Hospital, San Antonio, Texas. Burns, flash or flame on the face, we're going to talk about that, leads to airway obstruction, must be prepared to do a cricothyrotomy. That's somebody who gets flash burn in the face and they inhale it. And then you notice that their tongue and their lips begin to swell and they say, yeah, I'm having trouble breathing. They're going to die unless you do something. You call for rescue, but you probably can't get rescued in time to save that person. Now, what fluids do you give? This is a modification in the Brooke Army Hospital. And what you can't see, but you have it there, it says 1/2 ounce, that's a tablespoon of hydration fluid, and here's the hydration fluids. 1/2 ounce of hydration fluid per 10 pounds of body weight per percent body burn over the first 24 hours. The hydration fluids are one of the following. You can make your own with a half a teaspoon of salt and 3 tablespoons of sugar per quart of water. That's the cheapest. Now, gator egg is too potent for this situation, but if you dilute it, 1/3 Gatorade, 2/3 of water, or the kids like Kool-Aid, if you just add a half a teaspoon of salt, it already has sugar in Kool-Aid. Do they still sell Kool-Aid?
Yeah.
You can get Gatorade everywhere, can't you?
You can buy it all.
And they probably have other sports drinks that are probably equally good.
The sugar is very important. You got to be careful because there's some of them that are sold without sugar.
Yeah,
And so they substitute aspartame, which is not probably good.
yeah. Good comment, Mike. Listen to an example. This is a 180-pound person with 20% third-degree body burns. You know you're going to call for rescue with that, because with third-degree body burns, the threshold for calling for rescue is 10%. But this is somebody with a 20%. They're going to die of dehydration and fluid loss unless you start fluids right away. So if he's 180 pounds and he has 20% body burn, that's a half an ounce of fluid times 18. That's his weight divided by 10, and because that's a half an ounce of fluid for every 10 pounds of body weight. So you multiply it by 18 per percent body burn. That's 180 ounces. That's 5.6 quarts in the first 24 hours. And you're supposed to give half of that in the first 8 hours. That's 3 quarts of fluid in 8 hours.
3/4 of a gallon.
Think you can do that?
It's a lot of drinking.
And if the person says, no, I'm full, you got to say, I'm either going to pour it in your mouth or I'm going to give it to you rectally with an enema. And this is the enema thing. Now, that's the one thing I don't carry with me offshore is an enema bag. But if you're going to be complete, 100%, you probably should anticipate somebody having a 20% third-degree body burn and have enema potential.
I'll tell you a place where that could be also where you will get the burn. If you have an engine overheat problem, somebody goes down below or whatever, and they unscrew the fill cap thinking that they could put fluid into the engine before it's cold, you're going to get a lot of very hot escaping steam and water.
Right in your face.
Right in your face or all over your hands.
Yeah.
So again, if you have an overheating engine, you do not go down immediately and open the fill cap.
Good advice. Everybody hear that?
You shut the engine down, let it cool.
Now, if you use an enema, use a half a teaspoon of salt per quart of water. Let in about a pint at the time and repeat every half hour until you satisfy the fluid requirement. Now let's talk about flash burns of the face and neck, and this is the last subject before lunch. Now this is a guy who came in with a flash burn of the face, having trouble breathing, and they barely got, because it causes a burn of your airway and it all swells. There comes a point that they can't get a tube in. So the first thing they do is get a tube in. In fact, the EMTs who are on the site put a tube right in. You put tubes in, don't you? Yeah. And then to keep him on the ventilator, it's very annoying, produces coughing. They have to sedate the guy. So this is a sedated guy. That's why his eyes are closed, and you see the swelling of his face. Are you prepared to do a cricothyrotomy? And on your way out, I'm going to have you all identify the right place on mine, because mine's easy to feel. Here's the proper place, right there. On a man's trachea, you can feel this V-shaped thing. I can feel it on me. It's right there. Women, you can have a hard time. Juliana, can you feel that V up here? That's the V. Go down about an inch, and then you'll drop into this area. And now you're between the hard thyroid cartilage, and here's the cricoid cartilage. and there's a soft spot right there in the middle. And if somebody's choking from a face burn, take a knife or a box cutter, stabilize that part, and act like you're cutting a cucumber. And keep going until, because remember, they're gasping. Either air is going to go in or it's going to come out and hit you in the face while you're doing that. But that's good. Now, you remember the old story about the fountain pen. That hole was as big as a fountain pen. My suggestion is you get it big enough, see, about the size of this tip so that it'll go in. I carry something I got at the hardware store. I wonder if I have it here. Maybe I don't. Yeah, I do. This costs $1.50. And this is what to put in the hole you just made. Now, it's bleeding everywhere. But you got to tolerate that because nobody's going to bleed to death from a skin wound. Just ignore the bleeding. This costs $1.50. And it's a hose connection where you adapt a small bore hose with a larger bore hose. If you put that small one in, you're not going to get a hole big enough for that one. But you put this in and it has reverse barbs on it, so it's a perfect solution for your own performed cricothyrotomy. Your first cricothyrotomy.
There you go.
Now there's an alternative to this. And you can pack it in your, it's called a rush, and I'm going to give you a little video about it. Are you getting tired of the movies? Can you hear that okay?
The Rouge Quick Trach set consists of a pre-assembled cricothyrotomy unit with a 10mm syringe attached, a padded neck strap, and a connecting tube. The actual cricothyrotomy unit consists of a plastic cannula with fixation flange and 15mm connector, a removable stainless steel cricothyrotomy needle, and a removable stopper.
You can pass this around.
The cricothyrotomy unit is pre-assembled and ready to use. If intubation or tracheotomy is impossible or cannot be performed fast enough in the presence of acute respiratory distress with upper airway obstruction threatening to cause asphyxia, the use of the Rouge Quick Trach set is recommended to provide the patient with air again quickly. Hyperextension of the head stretches the skin of the neck and facilitates the identification of the laryngeal structures. Two fingers steady the larynx, while the index finger palpates the site of the puncture, the cricothyroid ligament. The anatomical situation is as follows. The thyroid cartilage forms the upper border of the cricothyroid ligament. The cricoid cartilage, the lower border. This means it can be felt as a clearly palpable depression between the two cartilaginous structures, a few centimeters below the Adam's apple in the midline. After disinfecting the skin, hold the larynx in position with one hand. Place the cricothyrotomy unit in the midline and perforate the soft tissues of the neck at a right angle. Keep aspirating while advancing the unit into the trachea. Now, incline the unit at an angle of 45 degrees and advance it further into the trachea until the stopper meets the skin. Remove the stopper. Hold the steel needle and advance only the plastic cannula. Withdraw the steel needle and advance the plastic cannula until the fixation flange lies on the skin. The fixation flange is secured to the patient's neck with the padded strap. To ventilate the patient, the connecting tube is connected to the 15mm connector on the plastic cannula. The other end of the tube is connected to a ventilation bag or system. Finally, ventilation is checked by auscultating both lungs. The patient is now
Now, you don't have a bag like that, but if you see in this little kit, there's a corrugated tube that you can attach to the end and you can blow and breathe for them. Then pretty soon, once the crisis is over with and they can breathe and make up for their excess carbon dioxide that they've already accumulated and lack of oxygen, then they can breathe on their own. My complaint is it's a little small, that bore of that. See this little hose that you get, so you can put that on the end after you follow that. But this, the bore of that needle looks a little small to me. What do you think?
It looks small.
And I thought this, I thought, well, in order to get away with marketing this, and they haven't maybe been sued yet, because it's still, I first presented this 8 years ago, and it's still on the market, so I guess it works. But I've never tried it. Got to think, anybody here, would you actually do this, or would you say, I'd rather do the cucumber thing?
I think if I had that available, I would go with that, because it's going to be a lot less messy. For a minimally trained person, I think the odds of that working, if you at least get it positioned properly or close enough, is probably greater than slicing away with a bread knife. So.
I asked my wife, she said, I would never do that. I wouldn't know where to put it. I'd be so nervous, I didn't know where to put it. So there were a lot of negative feedback when I asked people about it, that they didn't think it was much of a contribution to saving life.
You can always open a bigger airway by cutting side to side.
So cut the carotid arteries.
That's what the tourniquet is for, right? You got a crew, you want to put a tourniquet around the neck.
Yeah, that's right.
You didn't volunteer to let her try it on you?
That's just a mock-up, kind of out of focus of the picture of it. And now here's the first techie, Moses, getting the tablet from the cloud. And now it's time for lunch.
I give you these 15, 10 commandments. 15, yeah, oh, stand.